Will a national pharmacare plan impact your life?
To be honest, I don't know how it will impact us, but it doesn't matter about how it impacts just us. How it impacts society is terribly important, and I think it's a definite good move. I think that is something that we need and something that, the people really have earned and deserve, because when you take care of your own people first, good things happen, and that's what we all want to happen. We have friends that live in the United States, and we've talked to them about it, and they are absolutely envious of our social networking, and I'm a proud Canadian to say that.
No, it won't, because I have private health insurance.
Personally, I don't need any pharmaceuticals, so luckily it wouldn't impact my life either way. My mother's diabetic and needs insulin, and she's on old age pension, so it could affect family members of mine.
A national pharmacare plan, I don't think will have much of an impact on me. I'm a senior, and I'm lucky enough to have a drug plan from, I worked in the civil service. So for me personally, I don't expect it to have really any impact at all. But I agree with the concept, certainly.
The National Pharmacare Plan, so far as I understand it, is diabetes medication and birth control at the moment, with neither of which are going to impact my life in any way, shape, or form. I am looking forward to it, because I have no coverage of any kind. But they're going to be so selective in the drugs they include, I don't ever think it's going to benefit me.
For us, I have private medical. I do work for the shipyard, so I'm covered, but there's other people that don't have that opportunity. And as everybody knows right now, with the influx that's happening across the world, it would actually be best for everybody if there was one, and you didn't have to fill out papers every year to do so. If you have a change, obviously the government can track it with your SIN number. That's why it's there for. So I feel a lot of people would benefit from having the opportunity to have some kind of health care, yes.
Yes, the National Pharmacare program will affect my life. I'm currently covered by private insurance, but that expires when I reach 85, which is in August. And so I have to then rely on pharmacare and my own resources, which is not great, when I need medical care. And anything the government can add to that is a bonus for me. I've always said in this country we do not have a national health system. We have a provincial health system, and it's different in every province. So if I move to Ontario, I have to get a new health card, and I can get things done there that I can't get done here, and vice versa. So it needs to be a national. As a Canadian citizen, I should be able to get the same treatment when I go to British Columbia as I get here. But that's not the case. And so I think, yes, anything they can do to improve the health system, absolutely.
Will it affect my life? I don't think so, mainly just because of the kind of healthcare plan that I personally have. But I'm sure there are still lots of people out there who would be for or against.
I mean, doesn't sound bad to me. If we are trying to get medicine to people who need them, why not? It's probably going to put a little more strain on the taxpayers. I see that side of things personally as well, but if we can find ways, we can mitigate that.
Yeah, absolutely. It would impact my life. Being able to have access to proper medicine, at cost would be really beneficial. Definitely in my life, I've had a lot of periods of, unemployment and stuff like that. So, having access to these things would be really good. A good thing for our society, I think.
Well, I think a national pharmacare plan may not necessarily impact me directly, but I think it would impact a bunch of other people who need it. It's not everyone can afford healthcare nowadays, so I think it would go a long way.
Sure, my taxes will go up. I mean, look, we'd all like to have a program where everything is free, even groceries, but it's not viable. It doesn't make any economic sense.
Probably not my life very much, but it impacts many people that I know in a significant way. So I think it'd be great to have a national pharmacare program.
I don't believe it will. I don't believe it will. I don't know if it's something that I want to see happen. I honestly have been in healthcare on and off for the last 15 years, and healthcare is not something to mess with. It should be equal treatment for everyone, regardless of their economic status.
Not directly. I am very grateful for my healthcare plan right now, but that doesn't mean I don't support it for those who need access to diabetes medication and like everything around it. Like I absolutely support it.
Yeah, I mean, having access to things like this for people that need it is important, definitely. You can go over the top for sure, but people who are in need and sick should have access to things like that, and plans to support it are not a bad thing, I don't think.
No, I don't think so, but I'm pretty privileged, right? So I already have coverage with my job. So I count myself as being privileged in that sense, because there's a lot of people like my mom even doesn't have any sort of coverage. So something like that would definitely impact her. But as a middle income person, it wouldn't impact me the most.
Yeah, I don't think it's, we saw it unroll last week, and I don't think it's going to change much for us, ourselves. So we have a drug plan through my wife's work, and I'm self-employed, so I pay for everything myself. So.